And thank you so much for having me. I unfortunately am on service this weekend, so won't be able to stay for the question parts, but I have my email address included in the slides, and please feel free to reach out for any questions. I just want to say off the bat too that I think that this conference is phenomenal. The fact that you're having a multi-day discussion about climate change and mental health is really, really impressive, and it's really inspiring to me to see so many faces here who are excited and engaged in this work. So as mentioned, I'm Julia Rothschild. I'm a fourth-year medical student at Brown applying into psychiatry, and I'm here representing the Climate Psychiatry Alliance, specifically the Early Careers Network, which is a group of medical students, psychiatry residents, and early psychiatry attendings as part of the Climate Psychiatry Alliance. And we're really trying to spread information about the role of psychiatrists in addressing the climate crisis. And are you able to see my slides? Great.
Yes, perfectly. Thank you.
Yes. Great. So the guiding questions that I was asked to discuss today that I wanted to focus on were essentially what the main barriers are to addressing mental health within the context of the climate crisis, specifically to the field of psychiatry, and what we can do to reduce these barriers. I want to know what the largest misunderstandings about climate change are and its effects on mental health, and research and experience as a student, and how I've done work to add climate change and mental health within school programs and provide opportunities for you all as well. So just to give an overview of the Climate Psychiatry Alliance, it's a group of about 400 psychiatrists with the main mission to educate on risks of the climate crisis and how this impacts mental health and well-being. There's a lot to both educate and advocate on a clinical, this collective advocacy voice together. And we're open to international psychiatrists. Anyone's interested in climatepsychiatry.org is the website. We always love to collaborate. And our biggest goals are to inform, to provide resources, and to provide an influence policy as well. And so this is some components of climate change and psychiatry that typically in our general overview we'll go over, but I think you all have done such a tremendous job really highlighting the different aspects of climate change. Oh, did my camera go off? Let me see. Really highlighting the aspects of climate change and psychiatry. So what I wanted to mostly focus on was advocacy and action, and what we can do as psychiatrists to incorporate advocacy and action into our roles. So one of the questions I was asked were, what were the barriers to addressing mental health within the context of climate change within the field of psychiatry? And I really wanted to highlight a couple aspects. So I think one barrier is clinicians' internal forms of denial. And I think this falls on both extreme ends of the spectrum. So there's clinicians who feel hopeless versus heroic, and there's this thought that they need to save everyone in their actions. And all of this can be a form of avoidance and really just avoiding the difficult feelings of anger and fear in the middle that clinicians themselves need to work through in order to be able to incorporate climate change education to their practice. I also think that fear of engaging in the political can sometimes be difficult, especially in the United States as medical providers, despite the fact that the impacts clearly outweigh the risks of the consequences, the political consequences, but there's still some fear of bringing this into the clinical space. And one other topic too is that there's very little formal education about climate crisis in psychiatry. And I'll speak to this a little bit more later, but there's more understanding about acute disasters and how that leads to psychological impacts. But there's less information given about slower disasters like air pollution, drought, food insecurity, and how that affects mental well-being. So I just wanted to give a brief overview of how we as clinicians and psychiatrists and future psychiatrists, if there's those who are interested in pursuing psychiatry, can communicate in the clinic about climate instability. And these are pulled from an article about 3 for promoting adaptive coping. So one of the biggest things to recognize is there's no correct or best way of communicating about adaptive coping. I think it's important to provide information on risks, but pair it also with solutions. But I think you really have to work with the client and find their values and their group norms in order to have this conversation. And with this, I think you need to attend to the variability in both climate stressors and the message and the intervention recipients. So it's really important to draw on the client's beliefs and values, as well as their existential goals, and really focus on meaning-focused coping to evoke positive feelings that can help them bear these anxieties and these worries associated with the threat of climate change without minimizing or denying the reality. I think it's also important to recognize and encourage collective coping. So we want to avoid overburdening individuals, but we also want to avoid creating a diffusion of responsibility for coping with climate change. So it's really important to create this balance where we help individuals focus on meaning-focused coping and problem solving and really transform this anxiety into action, and also do this for our coworkers as well and ourselves, to really how we communicate about climate change and climate anxiety. The next question I wanted to address was addressing misunderstandings through research. And as I alluded to earlier, I think we sometimes have a difficulty in attributing climate change to more subtle effects and how that will contribute to, and already does contribute to, mental illness. So for instance, looking at extreme heat, I think it's really important for psychiatrists to be aware that many psychiatric medications have potential interference with the body's normal heat and fluid regulatory mechanisms. So for instance, antidepressants, antipsychotics, some anti-Parkinsonian drugs will interfere with heat regulation and the body's normal protective mechanism of sweating. And so it predisposes individuals who are on psychotropic medications to heat-related morbidity and mortality. We also see this with lithium levels that will rise with excess fluid loss. So it's really important for psychiatrists to be aware of the impacts of heat and other slow-moving disasters on their patient population. And I think this is sometimes considered less prominently in the mainstream media as opposed to more acute onset disasters like earthquakes or like hurricanes. I also think it's really important for research to continue to recognize the interplay of environmental trends of health and how this affects health equity. I think the conversation of climate justice needs to be centered around racial justice and really understanding how moving disasters affect different communities, of really highlighting how long-term drought can affect food and water supplies, and how this can affect the mental well-being and the economic well-being of land-based workers, those living in more rural communities. And then also focusing on how this can lead to climate refugees and how this can be negatively impacting psychosocial outcome. Another part of research that I wanted to highlight too is eco-anxiety. And I know that your conference has discussed eco-anxiety. And I think this is an interesting topic because I think it's been a little bit villainized almost by a couple articles that I've seen recently saying that this is a normal response. We can't pathologize this response. And it seems to be minimizing, how do I get this back? Give me 1 second. I think it's minimizing what can be climate anxiety and a real diagnosis. And so one of the things that I think is really important in research is this validation of these scales that can help us measure climate anxiety and these other psychosocial outcomes as it relates to climate change, and so we can really measure on a more official level. And so I just wanted to quickly highlight the different advocacy that we try to value as healthcare professionals. I think mental health professionals are really uniquely qualified to deal with the ramifications of climate disruption as experts in human behavior. And I think psychiatrists have a unique privilege, not only within the community as a trusted voice, but we can combine our medical background, our communication skill set, to really address climate instability and help transform anxiety into action on both an individual patient and a collective level. And so as I alluded to before, I think these are the elements that the Climate Psychiatry Alliance really tries to focus on in our efforts. So we're working at not only the clinical level, but also the administrative and advocacy level, in addition to promoting research projects and trying to work on promoting and providing professional training at every level of training for the psychiatrist. And so with this, I think it's really important, and this is work that we're trying to do in the early careers network of the CPA, is developing curricula at every stage of training to focus on the impacts of the climate crisis and really train the next generation of psychiatrists on what they'll be seeing with pre-existing mental illness, in addition to the emergence of new psychiatric conditions. And I think it's really important for us to continue focusing our efforts on giving this education at every stage of the training. And lastly, I just wanted to touch on what I've done and what you can do as a student as well. One of my classmates actually helped found the Medical Students for a Sustainable Future, which has really taken off in the last couple of years, and I believe would be open to, or it is open to international students as well, if there are any medical students in the audience. And it really tries to create collective advocacy to incorporate this into medical school curriculum. At my school, personally, we've created a climate change in health preclinical elective. We've created a task force to incorporate it into every block of education, at least one aspect of how climate change is affecting that organ system. And I think it's also really important to create eco-advocacy groups and educate your peers on the impacts of climate change and mental health, as well as write opinion pieces, support politicians, or even run for office yourself, depending on what your stage is. So I really just wanted to highlight with this that even just no matter where you are in your stage of training, if you're interested in pursuing psychiatry as a career or not, I think that there's something that you can do at both the individual and collective level. And I think it's a really exciting time. And just even being here, networking with other individuals who are interested in climate change and mental health is really, really amazing. And again, like I said, it makes me so excited to see so many faces here. And so with that, I apologize for going a little bit over time, but I just wanted to thank you. And there's my email address. If there are any questions, unfortunately, I have to go back to rounds, but please feel free to email me. I would love to talk more about climate change and psychiatry and also provide resources for the Climate Psychiatry Alliance.
Hi, everyone. My name is Dayoon Kim, and I'm a research associate from Stockholm Environment Institute Asia office located in Bangkok. So I really enjoyed Julia's presentation, and I really want to highlight more on the importance of health equity and climate justice together. So that's why I brought this topic here. I want to talk about the intersections between climate change, gender and social equity, migration, and mental health. So just to give a brief introduction of what kinds of work that SCI does, we are an international nonprofit research and policy organization that tackles environment and development challenges. And we acknowledge that gender and social inequities as shaping the root causes of disasters, as well as the impacts of climate change. Specifically, my team and my research revolve around the topic of climate change and migration. And last but not least, health, including mental health, is another dimension that many SCI teams are engaged in, and I will also touch upon. So here are three main guiding questions for this presentation. First, on climate change, intersecting identities and mental health. And second one on climate change and migration. And the third one on future outlooks on climate change and mental health. So before we go into answering these questions, I think it would be good to have an overview of key terms and perspectives that SCI adopt in our research. So first is gender and social equity and intersectionality. So gender and social equity dimensions are crucial axes of analysis for SCI's research. We see that multiple and intersecting social differentiation of gender, race, ethnicity, sexuality, age, and ability translates into privilege for some people and marginalization for other people. And acknowledging such intersectionalities is a key to our understanding of how climate change and social processes interact to encourage strategies such as migration and what are the outcomes and impacts of these strategies are. Another key word is climate migration. So International Organization for Migration, IOM, defines this term as the movement of persons who predominantly for reasons of sudden or progressive change in environment or due to climate change are obliged to leave the habitual place or choose to do so either temporarily, permanently within state or across the international border. Meanwhile, it is also important to recognize that empirically distinguishing the environmental factors from other factors is very difficult and often nearly impossible. So indeed, SCI sees that climate migration is also related to and reliant on existing networks of labor and other types of migration and not a standalone phenomena. So regarding the first question on climate change impacts and their intersecting identities, we believe that in any efforts relating to climate change, environmental degradation, and disasters, it is crucial for research and intervention to redress inequalities and ensure that initiatives don't exacerbate the pre-existing human rights infringement and vulnerabilities. And this can be done in various methods. Identifying vulnerable groups, gathering disaggregated data based on sex, age, disability, or other categories, ensuring presence and effective implementation and policies that protect their human rights. In addition, support for grassroots and civil society organizations and activists, so they are often most keenly aware of the needs of climate-affected people in vulnerable positions. So SCI is currently supporting women environmental defenders in Philippines, Nepal, and Thailand. So these environmental defenders are defending their land or resources against large-scale development projects that induce hazards and aggravate the impacts of climate change. So SCI is providing platforms for them to share their best practices. Oh, sorry. Yes. Sorry, it's still the slide. So of course, the needs and urgent challenges of climate or environmentally affected communities vary greatly based on the context. Often they may suffer from ensuring the most basic needs, daily discrimination and confrontation against more powerful groups. And it can also be their traditional knowledge or community system that is endangered, especially in the cases of indigenous communities, religious or ethnic minorities, displaced persons, or migrant groups. And all of these conditions not only affect people's physical health, but also mental health. And therefore, having deeper understanding of intersectionality and social equity is crucial in research of climate change, also giving crucial insights to climate change aggravated impacts on mental health. So the next question on the effects of climate change and migration, it is increasingly acknowledged that climate change is a threat multiplier that accompanies political and social factors to shape people's migration and mobility. And with further irregularities and frequencies in slow onset and sudden onset hazards, climate change affected population will seek alternative livelihoods, including through migration. And two current studies conducted by SCI Asia will aim to address gaps in these dynamics of climate migration. IOM research that looks into climate change, environmental degradation, modern slavery, and rural business. So our hypothesis here is that businesses not only they can induce displacement that affect a lot of mental health aspects of the affected communities, but also through a good ethical and environmentally responsible practices, they can safeguard the rights of migrants and that can enable migration as an adaptation strategy for migrants and their communities. And the second research is with Danish Refugee Council, DRC research that looks into nexus of climate change, migration, and conflict, and moving away from simplistic framing of climate change inducing conflict the research further investigates the nuanced dynamics of refugees and displaced persons who are also affected by climate change and environmental degradation at destination and transit countries. So how are all these connected to mental health? So there has been numerous studies in last 20 or more years connecting the sudden onset events to mental health concerns. Meanwhile, there are lesser evidence on impacts of slow onset events, although the gap has been being identified by ongoing researches. Also globally and regionally, there is a growing basis of health policies and frameworks that recognize the importance of the impacts of climate change and disasters, such as Asia-Pacific Strategy for Emerging Diseases and Public Health Emergencies, ASEAN post-2015 Health Development Agenda, but mental health dimension is still not addressed and analyzed in depth. Meanwhile, key global frameworks such as Sendai Framework on Disaster Risk Reduction actually have highlighted the importance of mental health resilience in the context of disaster and climate change. This framework established 7 targets of health resilience, including psychosocial support, mental health services, health workers' capacity, community health, and health facilities and infrastructure. In addition, we have to understand that determinants of health and root causes of climate and disaster risk and vulnerability share common drivers, such as social inequality and uneven access to services and resources. So women, children, elderly, or other groups from vulnerable backgrounds are unequally affected by climate change and disasters, and also by inadequate public health systems. So this calls for climate change adaptation, mitigation, DRR, disaster risk reduction efforts, and health management to work in synergy to identify and address these root causes together. So to conclude this presentation, we acknowledge that current climate projects and research have heavier focus on physical health, often sidelining mental health aspect. And SEI research have been engaged in numerous environmental hazard studies and analysis on lack of health access experienced by people from marginalized backgrounds. In such projects, mental health dimensions are also present, but not the main axis of analysis. Therefore, future research can highlight further on this dimension and explore more of this aspect. And so currently, mental health have never been set as a main subject of discussion in major climate change conventions. And stream of efforts with standalone focus on mental health, including this event, can aid greater research and interventions addressing climate change and mental health together. So thank you very much. Sorry if I have gone over time, but let me know if you have any questions. This is my email. Thank you.
Thank you for having me. I'm just going to share my screen. All right, let's see if this works. All right, you all should be seeing slides, yes?
Yes.
Okay, awesome. So I'm going to be talking today about some of my work and the research in general on climate change related disasters specifically, and mental health. So just to start off with an overview, I have a brief introduction to me and my research program. Then I'm going to be talking about disasters and mental health, which has been a lot of my focus. And then some of my work and thinking that moves beyond disasters and thinking about other aspects of climate change and their relationship to mental health. I'm going to end by talking about some implications for policy and practice. So I just want to start off by saying that it's nice to meet you. I'm really honored to be at this event today and to introduce myself and my research trajectory. Whenever I'm talking to students and younger people, I like to share, my background because it's been a bit circuitous at times. And yeah, just how I got to where I am today. So I'm Sarah Lowe. I am a clinical psychologist by training and a psychiatric epidemiologist. I'm at the Yale School of Public Health, where I'm also affiliated with Yale Center on Climate Change and Health. And so just to talk about my background, I want to flash back to 16 years ago. I had recently graduated from college. I was thinking about next steps and in the process of applying to graduate programs in clinical psychology. And at that point, my interest was really broad. I was interested in the mental health of adolescents and young adults from marginalized backgrounds facing socioeconomic disadvantage and racial and ethnic disparities. And as I was applying, Hurricane Katrina hit. So this is a picture of New Orleans after the hurricane and the subsequent breach of the levees. And I think, like for many people, that was a disaster that captured my attention and made me think about the ways in which disasters can elucidate pre-existing social inequalities and also have the potential to exacerbate them. It just so happened that one of my potential mentors for graduate school was launching a project of low-income single parents from the New Orleans area who had been part of a community college intervention study. And she and her colleagues had recently secured funding to pivot and focus on their resilience and recovery. So once I heard about that, I jumped on board, and I've been involved in that project ever since. And we're currently looking to expand it into an intergenerational cohort. So that sort of launched me into the field of trauma and disasters. And I've been really fortunate to have been involved in a lot of different studies of mental health after disasters and other potentially traumatic events. So other hurricanes like Hurricane Sandy and Hurricane Ike and Maria and Irma, other types of disasters like the Deepwater Horizon oil spill, mass shooting, sexual violence, occupational trauma. I have small projects on discriminatory experiences among Muslims in the United States. And most recently, I launched a small project looking at the intergenerational consequences of the 1984 genocide against the Tutsi in Rwanda. And I'd be happy to talk about any of those projects in the Q&A. But today I'm here focusing on the research on disasters and mental health. And while I think, of course, other indicators of climate change and their consequences for mental health are really important, there's been a lot of attention to disasters, and I think for good reason. One, because they are these acute major events, and also because they are increasing in several dimensions. So this chart is from CRED, or the Center for Research on the Epidemiology of Disasters. They're based in Belgium, and they've done an amazing job tracking the number of different types of disasters over time. So there's been a pretty clear increase in weather-related disasters in their frequency, but also their intensity, their speed of onset, and their global scope. So more and more people are being affected by these types of events. And this is troubling because the research to date has shown that disasters affect mental health in a variety of ways. So when people think about disasters, they tend to think about trauma-related disorders. And this is for good reason, because disasters can be traumatic and they involve a lot of potentially life-threatening exposures like injuries, destruction of property, bereavement, so on and so forth. And indeed, disasters have been associated with trauma-related disorders like PTSD, which is, most people know what PTSD is, but it's a disorder characterized by 4 clusters of symptoms, re-experiencing symptoms like nightmares and flashbacks, avoidance symptoms, so avoidance of people, places, things, emotions, thoughts, sensations related to the experience, negative alterations in cognition and mood, so thoughts that, it was my fault what happened, or the world is unsafe, and feelings like irritability and sadness. And then alterations in arousal and reactivity, so an exaggerated startle response or emotional numbing, difficulty sleeping, and things like that. There's also acute stress disorder, which is sort of a precursor to PTSD, shares many of the same symptoms, but can only be diagnosed within the first month of exposure. So these have been the focus of a large body of research, but we also know that disasters are associated with other types of mental health conditions, among them major depression and generalized anxiety disorder, substance use disorder, as well as other clinical phenomena or symptomatology that doesn't necessarily map neatly onto psychiatric conditions. So sort of free-flowing or generalized non-specific psychological distress. In children and adolescents, their symptoms often don't map on well to psychiatric conditions. So internalizing symptoms are mood and anxiety symptoms or problems. And externalizing symptoms have to do with behavior and attention. There's also been studies showing that disasters increase suicidal behavior and ideation and disrupt health behaviors that are related to mental health, like eating, sleep, and physical exercise. So people often ask, well, after a disaster, what can we expect in terms of the prevalence of PTSD and other disorders? And that's a really hard question to answer. And prevalence rates have been all over the place across epidemiologic studies. And this has to do with variability in the disasters themselves. So how intense they are, how much communities were affected in the samples. So who's included? Are there people who are displaced? Who's enrolling in a post-disaster study, as well as the timing of assessment. So we know that symptoms tend to decrease over time. And all that said, what is clear and a consistent message across these studies is that most people are resilient, that they don't develop psychiatric disorders, or at least chronic ones. And so what we do in our research is focus on factors that shape variability in mental health responses. So here I have what I call a socio-ecological temporal model, which considers risk factors both across ecological systems and over time. So thinking about socio-ecological levels, we know that the risk factors span individual characteristics like demographics, pre-existing physical and mental health conditions, family and social relationships, so social support, family cohesion, family stress, community factors such as how much a community was exposed to a disaster, the resources available in the community to cope with disasters, and then policies, including local, state, and national policies having to do with disaster preparedness and response, and other factors that shape exposure. In terms of time, when people think about disasters, they often focus on what we call the peri-disaster period, which is the period of the disaster and its immediate aftermath. And certainly people who face more exposure are at risk for adverse short and long-term outcomes. But we also know that factors at other time points matter, that people who have pre-existing risk factors tend to face more exposure and experience more adversity in the aftermath of disasters, and that disasters themselves can yield additional stressors and disruptions in resources, and that these together contribute to long-term outcomes. So I think it's important to consider both different levels of risk and how risk factors unfold over time. So I mentioned that in my new position, or relatively new position at Yale School of Public Health, I've been trying to deepen my research on disasters and mental health, while also considering the other ways in which climate change can influence mental health. And I have to say, the materials that you all put together for the meeting were amazing, and I'm definitely going to use them as a resource myself. But just to talk about some of my work in this area, I was really fortunate to have been a part of a briefing for the International Society for Traumatic Stress Studies on global climate change and trauma. So thinking about climate change from a trauma perspective. And in that briefing, we talked about the other ways, in addition to disasters, that climate change can be traumatic and in turn trigger a variety of mental health problems. So we discuss how extreme heat and disasters can lead to an increase in violence. So it's been shown that these types of exposures can lead to increases in aggressive behavior, in child abuse and intimate partner violence, and even self-directed violence, such as suicidality. And these in turn are traumatic events and can contribute to mental health. As Dayoon talked in her presentation, climate change can lead to migration and displacement, both forced and voluntary, and in turn can lead to conflict over resources and group-based discrimination that can escalate to violence, and even if it doesn't, has mental health implications. That climate change can lead to injuries, such as due to melting sea ice, to heat leading to disruptions in attention and concentration, increasing risk for accidents, which in turn are linked to mental health. That climate change impacts illnesses. So for example, the transmissibility of infectious diseases, that extreme heat can lead to conditions like stroke and congestive heart failure, that air pollution and wildfire smoke can contribute to respiratory conditions, and these are all linked to mental health. And that finally, that impacts are cumulative. So people who experience one climate change exposure tend to experience more than one, and these work together to erode our mental health and functioning. I also want to touch upon other clinically relevant or mental health relevant phenomena that Julia touched upon in her presentation, and that have captured a lot of mainstream media attention, including ecological grief or despair and sadness, looking at a changing landscape, climate change anxiety, so worries and concerns about climate change that impact behavior, cognition, and mood. And solastalgia, which basically refers to feelings of nostalgia and sentimentality for a changing home environment. So a feeling of homesickness while still in one's home. And I think, as Julia touched upon, these concerns can be criticized as people pathologizing normal responses, because I think they are very valid responses to a changing landscape and the threat of future harm. But they also can be related to mental health problems. And so research is trying to distinguish between, when are these valid responses that can drive action, and when are they disrupting people's everyday lives. And so I've been involved in a little bit of work with Susan Clayton, who developed the climate change anxiety scale that Julia presented, as well as Sarah Schwartz from Suffolk University and her colleagues. And we did a study looking at climate change anxiety and clinical symptoms of depression and generalized anxiety. And what we found was that climate change anxiety was associated with generalized anxiety, but it wasn't a one-to-one ratio. And that for depression, climate change anxiety was associated with higher depression, but only for people who were not engaged in collective action. For people who were engaged in activism, that actually buffered the impact of their climate change concerns on depression, which I think is something to highlight today and show the value in what you're doing. I want to end with just some implications. Of course, we should do everything we can to address climate change, reduce carbon emissions, invest in renewable energy, because of the myriad benefits of doing so, but mental health is one of them. Similarly, just broadly, we need to target social determinants of health, housing, employment, social networks, because these shape exposure to climate change and pre-existing risk. We need to increase access to mental health services to foster resilience against climate change and give us the fortitude to work against it. We need to think about resilience building and encouragement of action in youth, and also specifically for disasters have an extended timeline of support. So oftentimes resources are cut off at like the 1-year anniversary after disaster before needs are adequately met. So that's all I have. I want to thank you for having me today. I have my email and my personal and lab Twitter information, and I'd be happy to answer questions in the Q&A.
Okay, so right now, if you have any questions, please raise your hand or write them down into the chat, and we'll try to answer them. So,
hello, I have a question. Oh, sorry, do I have to put my hand up?
Yes.
This is sort of a question for anybody, and you've all kind of touched on it, but I was wondering if you could all expand on it. But the idea is around what can sort of the average person do towards helping with mental health and climate change as well. Not all of us are in medical school or doctors or psychiatrists and things like that, but I'd love to know what an average person can do to help with this whole situation. Thank you, and wonderful presentations as well.
I mean, I can provide a preliminary answer to that. I mean, I think what you're doing today is one great thing. So getting together with like-minded people and brainstorming what you can do. I think individual action is important. So, doing things that are sustainable, whether it's having a vegetarian or vegan diet or composting, reducing energy use, so on and so forth. But, I would say engaging in some form of collective action. So finding or developing organizations within your community to connect with people who have shared values and to, give the issues you care about a voice together. Because I think that's how true change happens. And you can also build a sense of social support. While at the same time, also I think sometimes people who engage in activism have the potential for disillusionment and burnout. So making space for yourself to engage in self-care in whatever way makes sense for you.
I definitely want to echo what all Sarah have said. Like, of course, there are individual efforts such as being vegetarian or vegan, or using less kind of plastic, but that's, you know, and also like these also have to happen in a systemic level. That's why we have to tackle a lot of policies that is happening on the ground, like that can really change these issues that happens through the supply chain. And that's why we want to ask the responsibilities of businesses and also the states on these efforts to really make changes to, for us, all of us, to not live in the world where we suffer altogether. So that's just a little addition, but definitely agree.
Thank you. Now we have a delegate from Algeria has a question.
Thank you so much. My question is for Dr. Sarah Lowe. Because I have a background in the medical field, I was intrigued by the practical and the clinical level. And I want to know what are the different methods used in taking in charge the patients suffering from PTSD, post-traumatic syndrome. And is the EMDR, which is the eye movements, desensitization and reprocessing method alone is effective? And how do you take in charge the people suffering from anxiety? Thank you.
Yeah, that is a really good question. So I am a clinical psychologist, but I'm licensed, but I do not currently practice. But I can say, you know, empirically supported treatments for PTSD, EMDR, as you mentioned, is one of them. The other ones are cognitive processing therapy and prolonged exposure. And these all, I think, include some element of exposure to one's experience and, you know, changing one's relationship with one's experience and fostering a sense of safety and stability. So yeah, those are ones that I recommend, but I also think that they're not one size fits all. And so when people come to your office with PTSD, that might not be where you want to go. So making sure that people have a certain level of stability in their lives before they can tackle trauma. Like when I was in clinical practice, you know, I would have people come in and they'd have these really intense trauma histories, but they were also struggling with like housing and they were unemployed. And so those things were kind of more pressing concerns. So being aware of the environment, and then also supporting other practices that may not have the research background as cognitive processing therapy and EMDR and prolonged exposure, but that preliminary work has been shown to help. Things like, you know, yoga and meditation, mindfulness, and other forms of self-care.
We have a question from delegate from Lebanon in the chat. He asked for any of the speakers, since climate change is far from being solved by our current behavioral, how can we help people to face the future's multiplication of disasters and overcome climate change fatigue in the long run?
That's a really good and important question, and in all honesty, sort of an overwhelming one. I'm like, oh my gosh, how do we do that? I mean, I think, you know, investing in preparedness at all levels, as much as, you know, governments are going to do that, in terms of where we build housing and things like that. I think building climate change preparedness and individual efforts into educational curricula is going to be really important, as well as building psychosocial characteristics that we know foster resilience, like how to maintain a sense of hope, emotion regulation, things of that nature. And, you know, I would always say human beings are really resilient. So I think we're a very adaptive species. So I think there is hope that future generations will be able to face it without succumbing to psychopathology or psychiatric conditions, but it is kind of an overwhelming prospect. So thank you for that question. And I don't know if Dayoon, if you have anything to add to that.
I also agree that it's a great question. And I guess not having like a siloed efforts is also important. So like often climate change, like currently it has been just one climate change adaptation plan that's just built separately from other kinds of plans. So often you will see a lot of governments developing these climate change mitigation adaptation plans, and also like certain development plans that kind of cuts down these efforts. So it has to happen all together very organically with collaboration between ministries. So having like pushing for those efforts through research is what SEI does. But personal point of view, I honestly don't have any definite answer, but I'm just keep trying my best from my positions, my approaches, and having strong belief that like other people and everyone here would do the same and more. In that way, we kind of regain that health, like kind of health together, like so both physical and mental health and health of our planet. So yeah.
Laura, Vice Chair.
Hi, the presentations were really good and we learned a lot from it. I have a question for Sarah Lowe. It was very interesting to know the part of eco-anxiety, which was pretty new and which is evolving. So as a clinical psychologist or like being in this field, how often have you seen cases of eco-anxiety after a disaster?
That's a really good question. So like I said, I'm not a practicing clinical psychologist, so I can speak more just anecdotally and from research. I think it's often actually surprising that after disasters, people aren't more anxious about climate change. We've done some research with some of our disaster exposed samples, and some of them still don't believe in climate change and aren't doing anything to increase risk against further disasters. So yeah, there's the experience of disaster and whether that increases climate change anxiety. I think for some people it does, and for some people it doesn't. And I think similarly, these major disasters get a lot of media coverage, and rightly so. And I think just seeing day after day, disaster after disaster does increase widespread anxiety. And then I think as a clinician, it's like, well, what do you do with that? And in clinical psych, I've gotten a lot of pushback when talking about climate anxiety. Well, people are like, well, it's just generalized anxiety. Like people who are going to be anxious are going to be anxious about anything, and they're going to be anxious about climate change. And I'm like, I don't know, this seems kind of different, because this is a real threat and it's an urgent one. And it also doesn't always correspond to generalized anxiety or major depression. So I think as a clinical psychologist, I think in general, like not just with climate change, a big part of our job is like validating real life stressors and giving people the tools to cope with them. So I wouldn't want to, as a clinical psychologist, try to dismantle the person's anxieties about climate change and give them all these reasons why they shouldn't be anxious, but rather to enable them to sort of sit and cope with their anxiety, and also use their anxiety as motivation to get involved and do things.
Thank you for that. And I hope we find ways to separate from the normal anxiety and eco-anxiety after a major disaster. And I really hope we don't find a lot of cases of eco-anxiety in general.
Mm-hmm. Yeah. I mean, I think a little bit of anxiety and stress is not necessarily a bad thing. Like a moderate level of stress can be really motivating. and can get people to act. It's when it surpasses that level where it's getting in the way of people's functioning and action that it's problematic.
Yeah, thank you.
Get from Maldives.
Oh, thank you so much. So I have a question for Dr. Sarah. Dr. Sarah, thank you for a very informative lecture. So I have a questions. So I understand from your lecture. So climate change makes many people to move another place, displacement. So, but looking at the entire world, I think the climate change and COVID-19. So it makes the isolation and internal conflict, especially Afghanistan situation. So we need to think about the situation for psychiatry things, depression and anxiety. So it seems to me it get worse more and more than before. So I think we have so many things we have to do. But I understand we need to do step by step. But what are most priority things we need to do the first? So this might be a fundamental question, but please tell me about that.
Yeah, I think that is a really big question. And you brought up a lot of different issues. So climate change, migration, which Dayoon spoke about, COVID-19 and the variants that are developing, the conflict in Afghanistan, which is so tragic and troubling, as well as climate change. I think these are all intertwined problems, but they're all also separate problems too. And so it is really hard to prioritize, right? So I don't know if I have a good answer to that. Yeah, Dayoon, I don't know if you have thoughts, given your background.
Me?
Dayoon, or the other speaker.
Regarding the eco-anxiety, or
about what should be our priority?
What should be our priority? I think it isn't like one priority that we have to focus on. Like it's always, given our backgrounds with, a lot of you are having this health background, while I do have a international development background, where I see differently than what you see in climate change topic. So I think it is always a priority for our perspective to approach from this way. And then when we move together, and again, like not letting efforts to be siloed is always important. And then always like finding opportunities to connect with each other and connect these efforts. It's really crucial. So those can be priority, I can say, I guess. But yeah,
that's a
greater priority. Yeah.
Yeah, I think, there's a piece of me that's like, well, all of them should be the priority.
Yeah, exactly.
And
exactly.
I think it depends, we all bring something different to the table. So, focusing on like what you can do given your background, but I also really love what you said about connecting. So I think as a researcher in this area with a clinical psych background, I realized that the best work comes out of transdisciplinary collaborations, that like you can't do everything. And like I've tried to like learn computer program, and it's like, I mean, maybe you can, but we only have 24 hours in a day. So, bringing your expertise and then working with other people who have complementary expertise in solving these complex problems.
Thank you so much.
Delegate from Malaysia.
Thank you. And thank you for the really interesting and informative topics. I'm really interested in the social equity and health equity, especially from Dayoon just now. Just want to ask, are there any risk assessment framework to identify those who are most vulnerable to climate change related impacts? And if there isn't, do you think it's useful to develop one? And what do you think will help with developing this kind of risk assessment framework?
I think that's a very great question. So regarding risk assessment in terms of identifying the most vulnerable groups, like different projects have different like focuses. So for example, for DRC, we would be looking into the conflict, climate change, and migration dynamic, and we are integrating the perspective of gender and social equity. So while we do this analysis, we do have like certain frameworks that we try to be not excluding certain groups of people or not using certain phrases, certain framings that exacerbate those like stereotypes. And our research products really try our best to address the root causes, address like intersecting factors that go into this conflict, climate change, and migration dynamic. But having, I guess like in SCI, like because of such a diverse topics that we discussed about, there isn't like a set one risk assessment framework, but it is something that can be discussed for sure. So thank you for that input.
Thank you. We have time left just for one last question, and it is for Dayoon Kim. The question is, what are the examples of livelihood programs that has been developed in the past and how sustainable it has been? Who were the target groups?
While I was answering, I tried to type it because I wasn't sure if that was going to be answered. So thanks, Ronan. Thank you very much for your question. So SCI Asia often does not directly engage with developing livelihood programs in a local level, as our focus is on research and mostly like regional or national level. But we have been supporting, as I mentioned briefly in the presentation, we have been supporting grassroots organizations in Philippines, Nepal, Thailand, where they provide resources for Indigenous women and men. And we, like from SCI side, we are providing those organization platforms to present their practices to bigger organizations or donors or policymakers, so that their efforts kind of reach to more, policy level, or maybe they might be able to secure funding sources through those donors. So those are the efforts that SCI Asia is making, kind of connecting. So I guess this project has been going on for 2 years now, and then at the end we have these kind of best practice sharing session where we try to see the future connections, whether they have made actual like funding opportunities through donors, like things like that. So that is kind of like the assessment at the end. So we try to be more make the project more sustainable, not just remaining in the project, but actually connecting those efforts to longer term. But yeah, we're trying our best, but always it's a struggle of project-based organization where the efforts do not sustain longer term, and it's often not our not in our hands sometimes.
Okay, thank you so much. We're out of time. We're gonna head to the break. Thank you so much for our speakers. Thank you for the delegates for your questions. It was a lively discussion, and we'll see the delegates in 10 minutes for the regional block 4. And thank you so much again.
Thank you. Take care, everyone.